Pelvic organ prolapse. If you are familiar with this term, or if you are living with pelvic organ prolapse, I'm pretty sure that you are aware of the accommodating fear and anxiety and worry and shame that comes alongside a diagnosis such as prolapse. Today, we are speaking to Clare Bourne, a pelvic health physiotherapist, a mum, a businesswoman, as well as an individual with prolapse. She is giving us an unfiltered and informative interview that is just so full of relatable information. We're talking about the symptoms you might be experiencing, about future pregnancies, deliveries, cesarean versus vaginal deliveries, and whatever it might look like in between, as well as exercise. She is giving us her lived experience as well as her clinical experience in and around prolapse. Clare Bourne is a pelvic health physiotherapist with a passion to support women and men throughout their lives. She believes in talking openly about taboo topics and ensuring everyone feels comfortable to get support even for problems that may feel embarrassing to talk about. She worked extensively in the NHS before starting up her own private practice. She's a mum of two and has learned firsthand the importance of care and support during the perinatal period. Clare is the founder of All About Mum, which provides postnatal education cards, webinars, and ebooks to support women with all the information they deserve. Prepare to leave today's interview feeling validated and feeling as though you can advocate for your comprehensive health and well-being in its relation to prolapse. Enjoy. Welcome to today's episode of the Nurture Pod, where we will delve into curious questions in pelvic health. I am Candice Langford, a pelvic health physiotherapist, eager to explore the minds, skills, and expertise of pelvic health professionals, and of course, share those conversations and learnings with you. But first, let's talk about bladder leaks. Are you using the correct pads or panty liners? Because periods are not the same as pee. I'm excited to share that Lilette's have a new range of dry lock pads and panty liners specifically designed for incontinence with 3 times more absorption. Pads and panty liners are not a band-aid solution to leaks. As a pelvic health physio, I believe that the correct products play an important role in giving you the control and the confidence to move through your day whilst working with professionals to improve your symptoms. All right. Hello, Clare, and thank you so much for being here today. I, as have mentioned, am wanting to ask you a really important question because I feel as though you've got some incredible insights to share with everyone that is listening. And that question is going to be in and around prolapse. So I would love to know your personal insight as an individual that has spoken up about having prolapse, but also someone that is a mom as well as a pelvic health physio that is really well respected within the industry. So if you could ever so kindly just share with us, just your perspective, your insight, your knowledge that we can all take home and learn and gain from.
Oh, yeah. Well, thank you for having me. I just love these conversations, and I think they're so important to keep having, because I still think prolapse as a topic is still not spoken about very much. And I think our narrative around it is hugely changing, I guess, from even when I trained and was first working in pelvic health just over 10 years ago to where we are at now. Is a very different conversation. So it's really exciting. And, I think hope and promise for women is growing. And I think there's still much more for us to do around spreading that word. So, so I guess, I had so much knowledge about prolapse, like I was working in pelvic health before I fell pregnant, before I had my kids. And I guess just a bit of background about what prolapse is in case anyone's listening that doesn't. But we're talking about pelvic organ prolapse. Obviously, we can talk about other prolapses that occur in the body, like disc prolapse, I guess, is another one that we hear. But from a pelvic floor, pelvic organ point of view, and again, this is like a fascinating topic at the minute because what we've always said, it's like where a pelvic organ drops or falls down into the vaginal canal. Now there's these theories coming out about, is it, you know, more like about tension and that they're being pulled. And
Mm.
there's a great physio in the UK called Anna Crowell who's doing some fascinating work and kind of research in that area. And so I think, you know, the work around classification is also being really challenged at the minute. You know, we used to be like, it's 1, 2, 3, 4. Now we're starting to have the discussion of, is grade 1 actually within the realms of what we should be encouraging as normal postpartum?
Mm.
Postpartum, just within the realms of normal of life, that there are going to be changes. Like, we all know we have skin changes, like our face skin changes as we age, our body skin changes as we change, and so therefore our vaginal skin will change and tissues will change. So, you know, it's one of these things where I think we're constantly in this evolving conversation, which I think makes it really hard, because you don't really know where the goalposts are. But I think for me, in all of it, the most important thing, regardless of the theory, but regardless of the classification, is the woman in front of us and that we're working with.
Yeah.
And what she is feeling, what her symptoms are, and what we can do with the pelvic floor, with the pelvic organs, with emotionally, her goals, her lifestyle, what we can do to help her. Because really, aside of all the, like, you know, the, I guess, the grading and all the structural stuff, you know,
Yeah.
really it is the life in front of us that matters the most. So, you know, I often say to women, like, try and not think too much about the grade and the, like, all of those bits and pieces, because actually it's, that's not going to change how you feel as a person and your life itself. It's helpful and it can shape certain decisions that we do make, but let's try and think about practically how we make your life as easy as possible. And I think I
Yeah.
knew all this, but when I like lived it, it was just like just transformed, I guess, my perspective and my experience, really. You know, I was 28, so I was, you know, young. And you know, those words, you know, you've got a prolapse, I think the things that really as women we kind of fear the most.
Yeah.
It's funny, isn't it? Because I feel like incontinence has become a much more accepted part of life, motherhood, laugh it off a bit more. And I think it's a funny thing, because I think incontinence, though, like, it's not something I've experienced, so I don't feel like I can fully give an opinion on it in that sense. But I think the way women are like, always like, I can avoid it. I just don't go on the trampoline, or I just don't go for a run. There's ways of avoiding, I guess, that symptom. When
Yeah.
it's a very, very structural change like prolapse, which gives a very ongoing symptom all the time, it is very hard to get away from it. And unless you pretty much do nothing and lie down all day, the chances are you can't really escape your symptoms. So they are very different. And I think how we meant to deal with them is very different. Neither should be accepted as normal, or, you know, you just something you've got to put up with.
Yeah.
But I think they are very different experiences. And I think, yeah, I had never really realized how much I would feel like I had aged just through those simple words. And I think
Yeah.
that really expressed to me how much we've got to do around the narrative of prolapse in younger women, that it isn't just something that you're going to have when you're 60 or 70. It's something that you could be navigating for more of your life than you're not navigating. Um, Equally, we can't be saying to 28-year-olds, well, you can't exercise anymore, don't lift anything. It's like, what option
Yeah.
is that? I've got one child, I want to have another one. You know, I really enjoy exercise. Like, I can't do nothing for my bone health at 28, you know, and I'm going to hit menopause, and what, I'm not going to do anything for like 60 years of my life. Like, it's
Yeah.
just unrealistic and unsustainable and completely unhealthy. And so I think it's really driven this passion in me to be like, let's really understand the why. Like, why do we have these narratives? And more importantly, like, how can we make this approachable and applicable to women so
Yeah.
they can live their life? Because, you know, I would literally fear picking up my child. Like, that was a real fear. And like, now I don't. But having that feeling where you feel like you're almost choosing, do I deal with the child? Can I lift the child? Can I not lift the child? Like, as a mother, that is so conflicting against all of your natural desires to look after your child. But obviously, you're uncomfortable and you care about yourself. And it's exhausting. That's all I can describe it as, is this constant, like, tug against yourself, and these like voices in your head that are like, if you do that, it's going to make it worse, if you do that, it's going to make it worse, you know. And it's
Yeah. A
been a
lot of
huge,
fear.
yeah, so much fear. And it's funny, isn't it, because I think when I questioned that fear, I think that fear very much came from my training of what I had been told to tell women. It wasn't actually true for my situation. But, and I remember speaking to quite an experienced physio who was like, just keep your pelvic floor strong and keep your weight down. And I was like,
Yeah.
oh, that's really fascinating. And look, I get the whole conversation around weight. But equally, what we do to women is we're like, don't exercise, don't lift anything heavy, and don't put on weight. It's
Yeah.
like, sorry. Um,
Wow.
how?
Yeah.
Exactly. And I'm probably pretty low about myself, and you're telling me not to.
Mm.
It just is like, what? And when you
Yeah.
break it down, like some of the stuff that is said to women is utterly crazy.
Yeah.
And, yeah, in one breath we're saying lose weight, and in the other breath we're like, but don't exercise. And it's
Yeah.
like, if I
Yeah.
can't move, and these women are like fearful to walk down the street. So, I think there is just so much still to be done around this conversation to empower women. And I think just help them to understand just like what's really going on. I say to women, I find it really fascinating that like change in breast tissue and this breast skin, droopy boobs, completely acceptable. Droopy tummy, completely acceptable. Concept of vaginal changes. What? Yeah, no way. But I'm like, really? Like, it's just another part of change that we do have to come to accept. The symptoms, yes, we want to deal with the symptoms, but the fact that there are structural changes, are we really surprised? There's a lot of structural changes that happen in our body. And actually, when I started to piece that together for myself, I know there was clear differences. But actually, when I started to be like, my body has been through a lot, it has grown and stretched 2 times, there are going to be some changes. Now, what I do with those changes is what matters. But actually, accepting the fact that there has been change was a huge step for me in the right direction. That actually, I wasn't constantly wishing back to a time that I was never going to get back to. Like, I was never going to be 25 again. you know, that was not going to happen. So I either could accept where I'm at and try and move forwards, or I don't, and I stay where I am looking back. And yeah,
Yeah, I love what you have just said now. I mean, I'm just thinking, I'm so grateful that you are sharing this very personal story, um, because you've just added, I mean, even to me, completely changed my perspective. And I think it really can only come from someone that's lived it. Um, wow. Okay. So the things that are really standing out to me is that, our skin changes, our boobs changes, and we're okay with that. And it's just, it's flabbergasting. I can't think of another word to think how crazy we've felt it is in order for there to be vaginal changes or pelvic organ changes. And I think that weighs into the whole bounce back mentality that a lot of us have been exposed to. We see other changes in our skin, for example, but no, we must use these creams in order to reverse those changes. And you've had a baby, but oh, never mind that. We need to make sure that everything looks as though you haven't. And definitely something that we need to move from. But I really like this relation that you've made between our skin and our other tissues and everything else that we have in our bodies and to our pelvic floors too. And then the way that you've spoken about how we've been told or we're made to feel, and even in our training, and I can agree on that, how we've been told how little one must do, and that there's these words, and words matter, right? We speak about a prolapsed disc, and
yeah,
that is just surrounded by so much fear and anxiety of movement. And now we've used that same word for the pelvic floor. And then
yeah,
we use descriptors of pelvic organs dropping into the vaginal
yes,
canal. This really scary thing. And I mean, where are they dropping to? Are they going to drop out? Are they going to fall out? And that
yeah,
just exacerbates this sense of fear in us,
yeah,
and further causes us to, like you say, be fearful of picking up your own child,
mm,
and then questioning your future. Like you said, I want to have another child, but I'm scared of picking up this child.
yeah,
And as a physio, you were able to almost adjust that perspective and slowly see, okay, I've been told this, but this in my lived and personal experience, that doesn't actually make so much sense. I can't just sit and do nothing and lose weight and not pick up a child.
yeah,
But the average person doesn't have that perspective. They don't have the background and the training and the kind of critical thinking and the problem solving that we've been trained to develop. So thank you for sharing that. And I really hope that that just mind shift settles in with so many people so that they can realize, hey, yes, if I Google, it might say don't do this whole long list of 10 things, but I am a unique individual. Every single prolapse symptom and experience is different, and there's so much that can be done. I'm going to stop talking now. I'm clearly getting very excited about this very biopsychosocial approach that you're taking. Yeah, so I'm going to ask you to just carry on the kind of trajectory that you were on, and if you can maybe just share with us some of those symptoms that people might be experiencing, because there's lots of different terms and around prolapse, and although this sounds like it is changing with the colleague that you mentioned, but if you can share maybe some of the symptoms and then how that really comes into our life, what we can do about it, how does it impact exercise, work, future pregnancies, etc.
And yeah, of
Thanks.
course. So I think, like main symptoms that women report are this like heaviness, this dragging. And it's funny because again, I'd heard that description and I was like, I have no concept of what that feels like. And then I felt it and I was like, oh, that's what they mean. And it is, it's quite an intense, like heavy, draggy feeling. And so, but equally, some women don't. And this is what's really interesting. Some women will just be bladder and bowel symptoms, like not being able to empty fully of their bladder and bowel. Some it will be, you know, um, discomfort with intercourse. But to reassure a lot of women, and there is so much fear, I know, between, you feel like my vagina is different, I therefore feel different, I don't feel as sexy because I know my body has changed. But I say the majority of women that I have worked with, going back to sex, they have been absolutely fine. It hasn't been painful. Their partner doesn't know. No one's there thinking like, oh gosh, she's like broken for life. No one's actually thinking that. So just to reassure anyone if they listen that, that is something that's a very real fear. And there's nothing, for me, it's like feel the feelings. That's totally valid. Like I'm like, we need to talk that out. Don't just think, oh, that's a silly feeling. It's a valid feeling. Feel it. And then we need to talk about it and then try and think about how we move on from there. Because I think sometimes it's just like we just say to people, oh, no, don't be silly. That will be fine. It's like, it's not silly. It's a very valid and a real emotion that we feel. And ignoring that is not going to get us anywhere. We need to engage with that fear. But yeah, so I think sometimes sex is an issue. Sometimes women describe this, and someone was saying to me just in clinic yesterday, this like, oh, I feel like a bubble in my vagina. Like there's like a bubble that you can't pop, and I just like want to like wiggle to try and see if I can move it. So that's not, people don't often talk about that one, but I've heard a number of women say that to me. I mean, you never see that on like any, well, for us in the UK, like NHS symptoms, bubble feeling. Um, but loads of women do report that. The sensation that my vagina is just not quite right, that there's something there, like just so many different things that women describe it as. But I think a really important thing that you were saying there around fear, and this is where the whole relationship with the pelvic floor and prolapse, I think, is so key, is that again, like all the focus has been on strengthen the pelvic floor, get the pelvic floor as strong as possible, and then it's going to do all the support, and then hey presto, you're going to be as fine as possible. Whereas actually, again, that just leaves no space for the other end of the spectrum, as we know as physios, of tension. And actually, I think I'm seeing more and more, and this is not research based, this is very anecdotal, but also speaking to a number of physios, I think actually when you're fearful, as you say, that everyone's told you everything's falling out of you, what do? You hold on to hold everything up because you are like, I'm not letting go because that means everything's falling out of me. So that leads to more pelvic floor tension, or maybe not even tension, but just a pelvic floor that's not moving through range. It's a limited pelvic floor. That pelvic floor can't then respond to the lift of the heavy toddler, to the cough, to the run, to the sneeze. And I think through that, we're then actually totally disempowering women because they're so busy holding that they can't do the thing that they need to do to help their symptoms. So I think what I always say to women is like, and I say this to the majority of women, we just need to let go and we need to feel safe that letting go of our pelvic floor is not going to equal worsening of a prolapse or everything falling out of you. And interesting, I said my own personal story is actually I am only symptomatic now when I get pelvic floor tension. So often it's almost like once a year now, there's something stressful happens or life gets a bit bonkers. And then I'm like, oh, I'm really symptomatic again. And I'm like, what's going on? I can feel my old scar tissue. I go and see my physio friend. She's like, your pelvic floor's got really tight again, and probably because I'm then symptomatic, I'm then like, oh, let's do all the squeezes, let's hold, and then not fully letting go, not breathing well. We realize, we resort that, sort the pelvic floor a little bit, do my breathing again, my symptoms go away.
Amazing. Yeah.
Amazing. But this is the other crazy thing, is that we think symptoms are worse, prolapse has progressed. And yet often there's been no further progression of the actual structure of the prolapse. It's actually just the structures around it that have had problems. But again, I don't think we do this well enough with women. We're too busy just like, do your Kegels. We won't give you much advice, but just go squeeze. They don't know how to do it correctly, probably working into tension. And then we're like, oh, well, it doesn't work for you. The other thing that blows my mind is that we're like, you've got a prolapse. Okay, maybe you do want to run. And then women are like, well, you've told me I can't do anything. Well, screw you. I'm just going to do it anyway. We then don't do the functional rehab. So we go from like, do a few Kegels and sitting. Okay, fine. Didn't work. We'll just run anyway. I'm like, what other injury in the planet do we say, do a couple of exercises lying down? Cool, run 10K. What? No,
I know.
you don't do it. And yet
It's
it's
unfathomable.
it's unfathomable. You're just literally like, how has this become any way accepted practice? And when I say it to women, I'm like, if you had a knee op or you had tore your quad, would you literally do a couple of bridges on the floor and then run 10K? And they're like, well, no, obviously I wouldn't. And I'm like, exactly. So why, when we tear our pelvic floor through childbirth, we don't rehabilitate it in standing, we don't load it graded, we don't introduce impact gradually? After ACL replacement, okay, fine, slightly different. But there's all these protocols. I remember as a physio, it was like, you need to do this, you need to do this, you need to get them standing, you need to do multi-directional hopping, and then you might do a graded run. Pelvic floor? Yeah, do a few
6 weeks. Yeah.
squeezes, crack on. Bonkers. It's just so mad. So,
I love this word, bonkers. I love
probably
it.
very British. Oh, bonkers. Yeah, it really blows my mind. But I think the more we get that message out there, that there is so much from doing some Kegels to running or jumping or lifting. I'm 5 years, 5.5 years postpartum after my first, when I was diagnosed. I have now got into lifting weights.
Amazing. Yes.
Amazing.
Yes.
And I'm loving it. Now, there's many reasons I didn't get back to it sooner. Structurally, I probably could have done. However, I didn't because I was tired. I had a toddler. I was busy. I hadn't done the rehab I felt like I needed to. I just wanted to do another pregnancy and just, get through all of that. And now I'm ready. Now I'm ready. And that's great. And I think the main message to women is that just because you haven't done it 6 months postpartum, just because you haven't done it a year postpartum, doesn't mean it can't or it won't happen. It's just, give yourself time. You're never too late to give it a go. And I want to get back to running, and there's been just constant things as to why I haven't. I know physically I could, but again, this is the thing as a mother. There are so many factors. That contribute into your life. It's not just about, okay, I'm physically ready. Oh, good, let's go. There's tiredness. There is ill children. There is constant having to learn how to parent in a new phase of life. Like, oh, I've now got to learn how to parent two children. Oh, now I need to do it in a pandemic. Oh, now I've got to do the school run. Okay, now I need two, one in nursery here and one in school there. Okay, now I've gone back to work. Now I've got to do work and this one. There's always something, and it's just giving yourself grace, I guess, to have, time to do it. So I've probably just gone on loads of tangents there, but
No, I think you've done an amazing job of depicting that we are real people and we have got lives and we are not robots, and we need a personalized approach. And if anything, everything that you've said right now has just highlighted the importance of anyone with prolapse or thinking that they might have prolapse or having funny symptoms such as bubbles in your vagina, go and seek help, because there isn't just this kind of stock standard go and do X amount of Kegels a day that's going to help you. It's, what are your personalized goals? Where are you right now? Are you planning on trying to conceive? Do we need to
Yes.
work towards you feeling comfortable and confident with that first, as opposed to just being like, okay, well, I want to feel like I'm 25 again. I would like to run a marathon, and I also would like to have a baby next year. And I also think I've got grade two prolapse. And someone said this horrendous word of things dropping out of, uh,
Yeah.
and we are multifactorial. And
Yeah.
what you've just said has just highlighted that there's so many little things that weigh into your experience and your comprehensive rehabilitation that we can that we need to bring in.
Yeah.
So I don't feel like that was a tangent at all. I feel like that's a really real life story that a lot of people are going to be living and listening to and thinking, oh my word, I feel so validated. Oh my gosh, I'm not broken. Oh my word, I was also scared of lifting up my child. But
Yeah.
whoa, Claire said she's not ready right now to run, but she can run and her body's capable of it. And she's had prolapse and then another pregnancy and then another delivery. Whether it's cesarean or vaginal, doesn't matter. We can do both.
Yes.
But
Yes.
yeah, I think a lot of people are feeling very supported right now by your shared experience. Um, I would like to know from you, Claire. The things that tend to pump up a little bit, and you're welcome to just kind of go as brief as you want on these, is like I've said, pregnancy and delivery. Can you
Mm.
just share, because I know a lot of people might be feeling like, oh, okay, I cannot have another baby, or I'm so scared of a vaginal delivery. I know that it's possible. So can you share what this experience might be, and
Yeah.
yeah.
So I always say to people, it's like, listen, if you don't want to have more children, that's cool, but please don't let this define, because we should be able to support you enough to make this a possibility if you want to, in an ideal world, explore, expanding your family. And I think the main things I would say is there is not a foregone conclusion that pregnancy is going to make your prolapse worse, A, and that you are going to feel worse, B. Sometimes women feel better because you get all this amazing estrogen again, you get all this amazing plumpiness in the vagina, and actually you feel better. And I was shocked. I was like, I was almost waiting for that day when I felt worse, and it just never came. I just felt good. So I was like, oh, okay. And look, I did the work, I did the rehab, I kept going with my pelvic floor, I kept active. So, but I was really surprised. And then I think the other big fear, I mean, in some ways, what I say to women is sometimes you've just got to get pregnant and then deal with everything afterwards. Like, I knew I wanted more children. I remember saying to my husband, I've just got to not think about it. Let's just get pregnant. And then I'll just have to see how my body responds, and we'll make decisions about birth when that comes. Because I'm someone who'd love to plan it all and know every single step, but I couldn't because I just didn't know how I was going to feel. And obviously, I was open. I was like, if I feel terribly worse, I'm open to the cesarean. But if I don't, then I'm open to, a vaginal delivery as well. So I'd had a vaginal delivery first time, and in an ideal world, I didn't want to have surgery. I didn't. For me, the idea of an epidural freaks me out. The idea of surgery kind of freaks me out, which it's weird because I'm so medical, and I love medicine, and I think it's magical, but like it's just for me personally, I'm just not great with that. So I was like, I've done the vaginal birth, I'd quite like to do that. So I think the hardest decision, the most important thing when you're trying to decide, and I truly don't think it's black and white, and I truly don't think you should in any way feel pushed into one decision or the other. I don't honestly feel that there is an absolute right and an absolute wrong decision in it as well. I think I always say you can argue both, and you could probably do both and also be happy. I think the most important thing is that women feel heard, they feel known, and they feel, again, validated in what they're feeling at that time. So for me, my decision was, okay, I'm feeling pretty good. Ideal scenario, I would like a vaginal delivery. I did think about my other delivery and how I felt certain things had potentially contributed to my experience. I had a longer second stage and all the things I got my hospital notes and I went through it because I wanted to understand. I was like, I want to understand what went on so I can then make decisions about this delivery. And long story short, decided I'd like to go for a home birth because actually I had a relatively quick labour, and I found the transition into hospital quite impacted how my labour progressed. So in the end, I was like, and it was actually my husband, who is medical as well, who I thought was bonkers when he suggested a home birth, because I was like, you're a doctor, you shouldn't be saying let's have a baby at home. You should get all the help. But he was like, no, he's like, I saw you labour. We were great here. Everything was going to plan. He's like, I think you would have had the baby here if we hadn't tried to transition in. So we got the right support. We got midwives here, and actually, I had a very, very uncomplicated, super quick vaginal delivery in our kitchen, in a pool. and it was amazing, and it was the most intense hour of my life. But he arrived and nothing progressed, and it was, I felt a bit more symptomatic for a bit, yes, and I was anticipating that. My pelvic floor still had a big stretch. I still had a slight scar that and wound I had to deal with, and so that's always going to impact things. But again, I was so much more empowered. I had the lived knowledge that even if I feel worse now, I can get better, and that experience is so different once you've lived it first time. So, but what I say to him is, remember, there's so many options for birth. We break it down to like vaginal delivery or cesarean, but the spectrum of that is huge. And I know around the world, obviously, things work differently. But within the UK, I'm like, there are ways of having these conversations of like, last time I was induced, these things progressed, da 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 da. I don't want to do that again. Okay, so maybe make the conversation of like, if I get to 41, 42 weeks and we're discussing induction, I don't want to do that. I'd rather go for cesarean. Great, let's support you in that decision. Okay, the labor starts naturally, everything's going well. Okay, labor's stalling. Let's make the earlier call to have cesarean rather than waiting like we did last time, which may have also, for various reasons, contributed to why you had the experience you had. Or you just say, mentally, I can't cope. The anxiety, the fear, you know, having a prolapse and those symptoms really impacted my mental health and how I bonded with my baby. For me, I can't take that risk again. I would rather have a controlled, safe cesarean environment. Great. The decision behind it is so multifactorial. It is just like prolapse better or prolapse not better. I say to women, yeah, look, we can discuss grades. Will it get a bit worse? Will it not? But again, we're just looking at the vagina. We're not looking at the woman. There are so many factors. And actually, I felt for me, having a vaginal delivery, being at home was the best thing, meant I felt like I didn't have a longer recovery. But don't get me wrong, like I went over to like 41 weeks and I cried my eyes out every day, being like, am I making the right decision? And I remember my midwives coming. It was around Christmas time as well. I remember my husband, I was like crying and crying. My husband was going out with my daughter, and the midwife rocked up. And my husband was like, yeah, good luck. She needs a talk. And she just opened the door and I just cried and cried for like half an hour or something. But, all those emotions need to come out, and the fears are valid. And, I question the question, was I making the right decision? And sometimes, you know what, you just don't know. But the most important thing I say to women is it needs to be your decision. Because ultimately, afterwards, if things do get a bit worse, you need to know that you made the right decision for you with all the information you had, that no one forced you into this decision. Because, you're probably not going to regret your decision if you truly felt it was you that made it and it was right for you and your baby and your family at that time. So that's the most important thing, I think, in all of it, making those decisions. They're hard and we need to have lots of conversation. I do a lot of online consults with women about this, just kind of like going through. And I had a lovely story yesterday from a lady who's not in the UK actually. And she sent me a picture of her baby being like, thank you for supporting me. In the end, I managed to get my cesarean. It was absolutely the right decision. I'm starting this postnatal period feeling amazing. The birth was so positive. I'm feeling generally really good. And I was like, amazing, amazing. That's what it's all about. And yeah, she might have had a vaginal delivery and been fine, but that was not right for her decision in that time. That's what we've got to do. Hear the woman.
Yeah, I love that. Yeah, I'm just going to kind of summarize what you've said so far. You can have prolapse and you can exercise. You can have prolapse and you can have sex. You can have prolapse and you can go through another pregnancy. You can choose to either have cesarean. You can have a very happy and comfortable and in your home vaginal delivery. And going against how we started this episode, where we highlighted all of the things that we're made to feel that we cannot do, you've just gone with a very lived experience, absolute, I call BS, right? And thankfully, research is changing and it's supporting this, and we're looking more biopsychosocially, we're looking at the whole person. And it's really, I was smiling ear to ear when I just heard you speaking about how you delivered vaginally in your kitchen. Husband's in the medical field as well, and he's like, you can do it. We just need that support, and we need to feel as though we're making those decisions based on as much information as we can possibly get. And I think that brings me to my next point and asking you to just kind of weigh in on the physio side of things now. So kind of really helping people to realize, okay, I think this is me. I think I'm experiencing these things, or I was once told that I've got prolapse. What is the next? What can people do? Will they need to work in person? Can they just go and buy a device? Can they will they need to use pessaries, etc., or can they just do like whatever at home? Tell
Yeah.
us tell us what that's like, and then we can close off for the day about the physio side of things.
Yeah. Look, ideal scenario would be see a physio, one-to-one care, find out about your prolapse, find about your pelvic floor, look at your breathing, look at your abdominal wall, look at how you stand, look at how you move. Like, have an examination whilst doing a deadlift with a kettlebell. Like, that for me, I was doing that this morning and it's just so empowering for women. I'm like, your prolapse is not going anywhere. Your pelvic floor is doing the right thing and you are deadlifting 10 kg. Amazing. Right, let's start there. That's an amazing thing. That ultimately for me would be gold standard. Unfortunately, across the world, that is not always an option. Online consults I think can be incredibly powerful, and it's a whole new concept I think the pandemic forced us to do, but I'm actually seeing amazing results by just
Mm,
working virtually with people. And
I agree.
sometimes, we make the call of like, it would be really good to examine you now or have someone examine you who's more local, but it is an option. I think we can get an awful lot from amazing trainers as well who are doing a lot in the field, like postnatal courses that are trying to challenge this narrative. And again, I think bridge the gap between physiotherapy and other, trainers, maybe regular trainers, like, average, your average PT. And you've got these trainers that are trying to bridge the gap that kind of take you from being postnatal, doing your rehab, getting you doing more before you're ready to go to your CrossFit class. That sort
Yeah.
of bridges the gap. I think that's a
Yeah.
really powerful thing. Another
I don't
option.
I don't think you've got them in the UK, but so in South Africa we've got biokineticists who really do an amazing job of bridging that gap. So they exercise scientists, right? So they've got that much more information, and they train to work with special interest groups or special need individuals, whether that's pregnancy, postpartum, post-surgical, kind of taking that rehab load off of the physio and having more expertise on it and
Amazing.
carrying through. And then they can kind of refer out and be like, okay, go and join the gym now, go and join that class, you are prepared. Yeah, so in South Africa we got biokineticists, but now that I'm in the Cayman Islands and I've been working with more kind of US based
Mm-hmm.
protocols, I think you can say, they've got kinesiologists, I think.
Kinesiologist. Yeah, yeah, yeah.
Kinesio. I know that there's that kinesiotherapy and there's kinesiologists, so I must make sure I got that. But they also pretty much it's exercise science. So if you are listening from anywhere else in the world and you're looking for that person to help you to transition, then look for those qualifications.
Yeah, that's amazing. That's so good. And I actually, now you say that, I have met a few people here, but I think in the UK we're still so stuck in our very like NHS. It's very like, and rightly so. We've got nice guidelines, we've got things and legislation, and it's very important. But I think sometimes then we do, I guess, neglect some of the other options that we don't always have research about everything that can help. There's the whole conversation around hyperpressive, which we don't have time to have today. And I'm not an expert, but I'm interested. I'm like, at the end of the day, if there's an option that it could help a woman, then we should be considering it. Whether it's, I don't know, exactly got gold standard research or not, I think we just have to sometimes consider it again for the women in front of us. From
Yeah.
a pessary point of view, and again, I think pessaries are such a fascinating thing. I think they're becoming much more widespread understood, that they're not just something that you have when you're 60, 70, and that's it, when there's no other option for you. It's like, how can we use a pessary to actually support your postnatal recovery? How can we use it maybe in the short term? How could we use it to make you symptom free so you can dance the night away at your mate's wedding and live your best life? There are so many options for pessaries, and I think again, just having an open mind to that. But I think it's the thing, like, physiotherapy should be multifactorial. And I would say to women that, like, I did some physio, it didn't help, and I'm like, did they get you off the bed? Did we do everything we should be doing? Because I'm like, I'm more than happy to send you to a consultant for you to have that opinion if I truly believe we have done everything else first. But if we haven't, then I'm not happy to do that because we're missing part of the picture.
Yeah, yeah, and I think that that's a tough one, right? Because unfortunately, not all pelvic physios have that same exposure, experience, guidance, and getting off of the bed and doing examinations and standing and squatting and with weights and being very patient oriented with regards to what are their personalized goals. Not everyone is doing that, and it is really hard. But like we've said in the beginning, we in this transition phase where the diagnosis of prolapse isn't even very clear. So how can we expect this perfect knowledge translation to professionals, but more so even to patients? So unfortunately, it's not
We're not.
everyone is getting exams and standing, and I do believe that it will. That it will change, and the exercises as well, kind of exercise, and also kind of defining exercise not as just on, but defining exercise as your range of motion, your full relax. That's part of exercise. Your stretch, your mobility, that letting go side of things. That's part of exercise. So it's if you haven't had that experience of testing on and off the table and in different positions, etc., and you feeling as though you haven't made progress, then reach out to people like Claire, have an online consult with her, get that support, just ask those questions, and you might find some clarity. A virtual consult really in pelvic health are so valuable, and I think it highlights the importance of how much what we do is education based. It kind of forces practitioners to lead with that education base and empowering the patient themselves to make those changes, because at
Yeah.
the end of the day, hands-on stuff only does so much. It's what that patient does in their day, and they 99.9% of the day. When you're with me, it's 2%, 0.2% of the time, right? That was very bad maths, but I acknowledge that. 0.02 and 0.1. So yeah, it's enforcing that patient-centered and patient empowerment and patient education component of it, which we absolutely do when we do virtual consults. So yeah, thank you so much, Claire. I feel as though there's going to be a lot of validation gained from this episode. People really feeling as though they feel comfortable in talking about their symptoms, talking about their experiences, advocating for themselves with regards to, hey, that wasn't done for me. Let me dig deeper. Let me speak to X, Y, and Z, and see what we can do about getting to my personalized goals. I feel as though people are really going to feel that level of support, from chatting to you today and listening to you speak about your personal experience as well as your professional insight. So thank you so much. Is there anything that you kind of want to highlight as like a take home point for people to just remember, or go tell a friend, or whatever it is that you want to, just any parent that's living with prolapse, and navigating their day to day?
Yeah. I think, do trust your instincts on things like this. Because I get a number of women who come to me and they're like, oh, I really knew something wasn't right, but someone just told me, oh, that's just normal or whatever. You just have to live with that. Like, don't accept that. Know that you're stronger than you are. Know your pelvic floor is doing probably better than you give it credit. I always say to women, look, you're not literally walking around leaking all the time. You're able to stand up. Your pelvic floor is doing well. Yes, it can't quite do the higher level stuff that maybe we need it to right now, but don't unrecognize what it's already doing. So I just recognize what your body's doing. Know that this is a lot to navigate whilst you're also changing as a human, to learn how to be a mother, to learn how to change that perspective. And it's a lot, and finding it hard is also totally fine. Don't ignore the emotions. Like sit with them, engage with them, and then we can move forward. I honestly think unless we engage and sit with those emotions, we just can't move forward physically, mentally, and emotionally. And we've got to learn to support women to do that a bit more, so we can then, I think, move that forwards.
Beautiful, beautiful. Thank you so much. And I just want to throw in at the end there, like, if an individual does end up going for a surgical intervention, it's still incredibly valuable to work with someone, such as Claire, a pelvic health physiotherapist, because, like we've mentioned, there's so many other factors that weigh into your experience: the feeling support, the education, the guidance with exercise. So don't feel as though, because in all honesty, in all honesty, with absolutely everything. There is no one quick fix, and we have to put that work in. We don't arrive at the front line of a marathon and just expect to run and win. We put the work in, we put the effort in, we put the training in, we put the nutrition, everything in, and seek the guidance, because there's no quick fixes, and there's a lot that can be done on very many facets of our very complex and exciting and adventurous lives that we live. So yeah, thank you so much, Claire. All right, so before I steal more of your incredibly valuable time and steal more of your pearls of wisdom, which I'm really, really grateful for you sharing, I would like you to tell us a little bit about your All About Mum. So you're a really busy woman, and you've also got other products that can really help individuals. And tell us where we can find them, what they are, and we can just guide people to that.
Oh, amazing. Yeah, thank you. So I started All About Mum, which is, I mean, it's a variety of things, but just as a brand, I wanted it to be very much acknowledging that often women say, oh, it's all about my baby postpartum, what about me? And I'm like, this is all about you. So it's like, at the minute, it's a pregnancy webinar to help you understand your pelvic health in pregnancy and what you should be doing to help prepare and think about birth. It's education cards postpartum, which basically take you from like the nitty gritty of your first wee, your first poo, to your recovery, to exercise. But flashcards, so you don't have to read an entire book. You just literally pick it up. You can put them in your hospital bag. You're like, in the moment you need it, you're like, breastfeeding. Okay, cool. That's what I got to do. I'm going to do it. There's also the option of a postnatal ebook, which has similar information, but I just wanted to make it a bit more cheaper and accessible, so it's slightly more concise. I'm in the process of developing a bit of a cesarean ebook, so women who have lots more questions about cesarean, and I will be developing other webinars as the year goes. But yeah, that's really what it's about. It's just about a hub of education for women, pretty much to do what we're saying, to get the right information out in the time that they need it, and not 5 years later when they're like, why did no one tell me that 5 years ago?
Yes, yes.
So yeah,
Amazing. What a lovely gift to purchase for someone for
yes,
their baby shower. You're like,
that's it.
this
That's
is
what I
a
wanted it to
baby
be.
shower gift for the mum.
Yes,
Sorry,
exactly.
baby. Like, you got
You're,
enough presents, this one's for
you're
mum.
going to throw up on your cute picture, on your cute baby grows. Here's something to save your mum's vagina.
Yes. Amazing. Thank you so much, Claire. That sounds like an incredible resource. And like you said, it's you use the phrase at the minute, which I think is also very British. I love it. So it sounds like it's something that's going to grow and expand. So that's really exciting. I'm looking forward to that. And I'm sure that everyone that's got to meet you today will also be looking forward to learning from you further. So thank you so much. I'll be
Thank you so
putting all of
much.
your links and everything in the bio, I mean, in the page information, so that they can be led for further to you to keep on learning. So thank you so much
Amazing.
for sharing
Oh,
today.
thank you for having me. It's been great to chat.
Well, NurturePod listeners, until next time, please review and subscribe, and as always, stay curious. As a special treat for listening to today's episode, you can head over to the nurturepelvichealth.com website and use the code NurturePod for 20% discount on all pelvic and sexual health courses. This episode is brought to you by the Lillette's Dry Lock Incontinence range of pads and panty liners specifically designed for bladder leaks. Because you deserve to maintain a healthy, happy, active lifestyle in the presence of leaks. This is why when working with patients with incontinence, I encourage them to use the correct type of pads as they work towards their treatment goals.